Hi, I am Dr. Raghu, Cardiologist at Yashoda Hospitals, Hyderabad. Today we will discuss about complex angioplasty procedures. People with kidney failure, heart failure, elderly age, who have undergone a previous bypass surgery, people who have got a total occlusion of the arteries, these are the group of patients for whom, even though they deserve an angioplasty or a bypass surgery, many a time they have been denied the procedure. Why are they denied this angioplasty procedure or a bypass surgery? Because people with these high risk features like low kidney function, low heart function and advanced age tend to fare worse after an angioplasty. So, over the last few years, there have been lot of technological advances as well as technical advances to provide a successful outcome, a safe angioplasty and also a durable outcome in these patients with complex high risk patients. So, this procedure is called the chip angioplasty or complex high risk indicated patient procedure. So, these group of patients we perform angioplasty with proper preparation. We should all know that proper preparation before an angioplasty goes a lot of way in getting a successful outcome. Similarly, pre-procedure planning by the operator or the surgeon also helps to get the best possible outcomes and a durable result. So, to do this, we need to have to perform a chip angioplasty, we need to have an operator who performs at least 50 chip angioplasties per annum. They need to have equipment which can deal with these complex scenarios of the patient. Commonly, we use imaging tools like IVUS or OCT in these patients to achieve a zero contrast or a low contrast angioplasty. That means, contrast or the medicine what we use for during an angioplasty is detrimental to the kidney. So, we reduce the amount of the contrast by this. Similarly, to remove the calcium which is layered within the blood vessels, we use a atherectomy devices which can be either a rotational atherectomy, orbital atherectomy or a laser atherectomy to remove the calcium or the extensive cholesterol plaque within the blood vessels. We might sometimes resort to less number of stents by using a drug-eluting balloon in these complex subset of patients. Finally, use of intra-aortic balloon pump, impella or a PCPS or a cardiopulmonary support helps you to perform the procedure safely when the patient is in a critical scenario and requiring a high complex long procedure angioplasty. What are the outcomes after this? The outcomes are pretty good in good expert hands. The expert can give you a 95 to 98% success with less than 2% risk, whereas the same chip angioplasty in a less than expert can give you a success rate of about 70% success with about a 20 to 30% event rate, which can be which is not desirable in this group of patients. Finally, if you ask me, complex high risk patients are those patients who require an angioplasty or bypass surgery, but they are turned down from this procedure as they are deemed to be unfit for the procedure. But we are able to perform these procedures successfully and safely using new technologies, availability of high expert with a very good outcomes of a less than 2% risk rate. So, with these things I am sure with this knowledge which is acquired through this video, people who are looking for solutions for themselves or their near and dear ones can opt for an angioplasty safely without any lot of thought and homework to be done for this procedure. Thank you all. Thanks for listening.